This video presentation is made available to the public by Al-Hada Armed Forces Hospital Nursing Department for the use as an example of quality care delivered to every patient. Situation, patient's name, and doctor's name are entirely fictional. Any similarity in the presentation is not intentional. They serve as a reference and for educational purposes only.
Audio Jungle.
Marhaba! Clock strikes 5 minutes after the hour of 9.
I'm Mavi Clinton.
And I'm Jan Tao.
We welcome our international viewers around the world.
So good to have you with us.
This is a special edition of Taif Daily News.
For the headlines,
All people are having an eye on this medical institution.
Medical allied employees are very particular on measures that promote specific improvement in patient safety.
Here's Nicole Smith for the details.
Thank you, Mavi. The International Patient Safety Goals promote specific improvement in patient safety. Al-Hada Armed Forces Hospital is committed to follow the advice and recommendation of the International Patient Safety Goals. Let us now witness how safety measure is practiced in this facility.
Good morning.
Good morning, Doctor.
How are you?
Patient identification and the matching of a patient to an intended treatment is an activity that is performed routinely in all care settings. We are committed to establishing and maintaining a uniform approach to patient identification. The intent of this goal is twofold. First, to reliably identify the individual as the person for whom the service or treatment is intended. Second, to match the service or treatment to that individual. Patients are identified before providing treatments and procedures, and before any diagnostic procedures, such as taking blood or other specimens for clinical testing. Using the standard two-patient identifier process every time protects your patient and yourself. These are an acceptable patient identifier, diagnosis, procedure, patient room or bed number. Fall accounts for a significant portion of injuries in hospitalized patients, so all patients shall be assessed for risk of fall upon admission, with reassessment routinely performed to determine on query need for full prevention precaution when transfer from one unit to another within the facility, any change of status, or following a fall. In our facility, Morse fall scale is being used.
sir, do you have any history of fall within the last 3 months?
No, I don't have.
Okay, do you have any other diseases?
No.
That's good.
Fall prevention intervention checklist must be completed every 4 hours for low and moderate risk for fall, and every hour for high risk for fall.
Audio Jungle. Audio Jungle. Audio Jungle. Audio Jungle.
Hi, I'm Dr. Yusuf. I'm general surgery consultant. What's your name?
Abdullah Ahmed Rashid Al-Ateeb.
How old are you?
24.
Had you marking for surgery?
Marking the surgical and invasive procedure site involves the patient, and it's done with an instantly recognizable mark. The mark must be consistent throughout the hospital and must be made by the person performing the procedure and should take place with the patient awake and aware. There are various elements of the preoperative verification process that can be completed before the patient arrives at the preoperative area, such as ensuring that documents, imaging, and test results and paperwork are properly labeled and available. The timeout held immediately before the start of the procedure with all the team member present permits any unanswered questions or confusions to be resolved. The timeout is conducted in the location at which the procedure will be done, just before starting the procedure, and involves the entire operative team. The patient does not have to participate in the timeout procedure.
Yes, this is Dr. Yusuf.
Hello, Dr. Yusuf. Yes, this is from Male Surgical Ward. Yes, this is Hassan speaking. Doctor, I'm calling about your patient, Alutaibi Rashid Abdullah Ahmed. Yes, that first day post-right lobectomy. Doctor, I just want to refer because he has tingling sensation in the face and he's also tachypneic. The patient is actually 25 years old and then 62 kilograms.
Okay, how is he vitally?
The vital signs of the patient is the respiratory rate is 30 breaths per minute, and then the pulse rate is 98 beats per minute. And then the O2 saturation is 91% on room air. I have already put the patient on nasal cannula, 2 liters per minute. Sir, I think the patient needs to be seen immediately. Do you want to send any laboratory request?
Yes, it is most likely hypocalcemia. Can you ask for serum calcium?
Doctor, let me just repeat your order. Take serum calcium stat.
Yes,
That's all. Okay, thank you so much, doctor.
I'm coming. I'm in my way.
Telephone order from Dr. Yusuf, and then the patient complains of tingling sensation over the face. So the order from doctor is do serum calcium stat. So, please, sir, come.
High alert medications refers to medications that have an increased risk of causing significant harm to a patient when used in error, or medications that carry a higher risk for adverse outcomes as well as look alike and sound alike medication. High alert medications are identified by specialty labels, which are placed on all storage locations within the pharmacy, stored in separate containers. For look-alike and sound-alike medications, Tolman letterings are used to avoid confusion. Pharmacy department has made a list of medication pairs actually involved in medication error. When dealing with high-alert medication, we always enforce the following: independent double-checking of patient information, independent double-checking of dosage calculation, independent double-checking of drug preparation, independent double-checking by nurse in drug administration. Concentrated electrolytes are not kept in wards as floor stocks. The pharmacist will dilute it in pharmacy IV mixture room and label it using red auxiliary sticker. A lockable cupboard is allocated for storage of high-alert medication of patients for ICU and other special areas. Only consultants and registrars are allowed to prescribe high-alert medication. If in doubt with the order, we consult the doctor on duty. Telephone orders are not allowed for prescription of high-alert medications. Only verbal orders can be used in emergency cases. Documentation of independent double-checking prior to administration of medication will be on the medication order sheet. Crush cart contains some high alert medications and all labeled with red auxiliary sticker. Each emergency cart is equipped with a number lock and kept locked unless in use. Number locks are controlled by the pharmacy. The integrity of the lock and the lock number of the cart is checked every shift and recorded. All carts are opened and checked for contents once a week by 2 licensed staff members. The pharmacy has regular inspection in all units, making sure that the guidelines of high alert medications safety is strictly followed. Healthcare acquired infections are infections that you may get from healthcare facility while receiving treatments from different conditions. One of the common ways that bacteria can pass from one person to person is through lack of proper hand hygiene. If hands are not clean, microbes can be transferred from one patient to another. Small precautions can have big effects. Hand washing, for example, is a simple but highly effective way in reducing cross-contamination from healthcare provider to patients. There are 5 moments of hand hygiene. Before touching a patient. Before clean or aseptic procedure. After body fluid exposure risk. After touching a patient. After touching patient surroundings. Hand washing can take 40 to 60 seconds. On the other hand, hand rub with alcohol sanitizer can be done when hands are not visibly soiled. This only will take 20 to 30 seconds. We follow standard precautions with all patients. When we are close to or handling blood, bodily fluid, bodily tissues, mucous membranes, or areas of open skin, we use personal protective equipment or PPE. Transmission-based precautions are extra steps we follow for illnesses that are caused by certain germs. Transmission-based precautions are followed in addition to standard precautions.
Okay, sir, you're about to discharge, and here is your appointment slip. You will be back on after 2 weeks, okay? So here is your medications. So this one, Pantazole 40 milligrams, or actually there's a instructions over here, so the sticker. So all of this. So thank you so much, and
اوكي شكرا لكم يعطيكم العافيه وما قصرتوا ستاف كله كويس الحمد لله ونشوفكم على خير والحمد لله ومع السلامه.
We have just witnessed high quality of care medical allied employees in this institution. This is Nicole Smith reporting live in Al-Hada Military Hospital. Back to you, Mavic and John.
Al-Hada Armed Forces Hospital Nursing Department embodies pursuit of excellence.
Very efficient, transparent, and effective care to patients.
Broadcasting live from Al-Hada Armed Forces Hospital.
Serving you the most leading news of the hour.
Your news,
Your health,
our business.